everyone, welcome to Biophilia, your all-time study mate. Today we are going to continue with the second part about this chapter, that is viral diseases. If you like our videos and get some help to understand these concepts, then don't forget to like, share and subscribe to our amazing channel Biophilia. So today we are going to start with the second part जहाँ पे हम viral diseases के बारे में पढ़ने वाले हैं. And before this we had already completed the part 1 of this chapter wherein we had seen about the bacterial diseases. So bacterial diseases के लिए you can surely go and check the previous part in the description box and then continue with this viral diseases. So पिछली बार हमने 8 diseases cover किए थे which were caused by bacteria. Today we are going to cover 11 diseases that are caused by different kinds of virus. So one of them we are seeing the first, that is rhinitis, influenza, poliomyelitis, which is also shortened as polio. So polio या आप नॉर्मल भाषा में पोलियो बोलते हैं, but complete name is going to be poliomyelitis. Then dengue, chikungunya, hepatitis, smallpox, chickenpox, measles, mumps and rabies. So ये तो सिर्फ एक लिस्ट थे जिसको आज हमें कवर करना है. And now let's get into deep understanding each and every one in detail. So the first viral infection we study is rhinitis, also called as common cold. So rhinitis नाम नहीं सुना होगा, बट कॉमन कोल्ड यू हैव श्योरली हर्ड ऑफ इट एंड आपको हो भी चुका होगा. एवरी सर्दियों में आइसक्रीम ज़्यादा खाने पे कॉमन कोल्ड के सिम्टम्स नज़र आते हैं. सो दिस कॉमन कोल्ड इज गोइंग टू बी कॉज्ड बिकॉज ऑफ अ वायरस कॉल्ड एज राइनो वायरस. और ये जो राइनो वायरस ट्रांसमिट होता है, इट इज़ गोइंग टू बी वन ऑफ द ह्यूमन डिसीजेस जो बहुत ईजीली स्प्रेड होता है. एंड दैट स्प्रेडिंग इज गोइंग टू बी बिकॉज ऑफ इनहेलेशन ऑफ ड्रॉपलेट्स that is going to be coming out from the infected person through if one is coughing or one is sneezing. So coughing or sneezing के time पे one who is already infected should cover his nose and other person should also take precautions कि अगर किसी के छींटे उड़े हैं then the person should go and wash that area completely so that those droplets should not enter into your body and cause infection. So ये droplets अगर किसी हेल्दी इंसान ने उसे इनहेल किया है या इनडायरेक्टली इट हैज़ बीन ट्रांसमिटेड थ्रू कंटामिनेटेड ऑब्जेक्ट्स. हो सकता है आपने हैंकरचीफ की जगह पे हाथ रख के छींक लिया एंड दैट कंटामिनेटेड हैंड्स यू हैव टच्ड अदर ऑब्जेक्ट्स. हो सकता है वेरी कॉमनली यू आर गोइंग टू यूज द डोर नॉब्स. सो डोर नॉब्स पे से ये इन्फेक्शन फैलता है. यू माइट बी यूजिंग योर कॉमन टेलीफोन्स ड्यूरिंग ऑफिसेस और लिफ्ट के बटन्स. देयर आर मेनी public things that you touch and वहाँ से भी these common cold virus can be entering into your body. So what are the symptoms that one faces who has been attacked by rhinovirus? So first of all, rhinovirus का site of infection क्या होगा? It is going to affect the nose and the respiratory passage, and that too you see that it is going to be a upper respiratory passage and it is not going to affect lungs. So if you have attended the previous part of this chapter जहाँ पे हमने निमोनिया के बारे में पढ़ा था. So once you know about pneumonia में it is a bacterial disease that is infecting the lungs और वहाँ पे fluid fill हो जाता है. So pneumonia में lungs affect होंगे, but once you consider about rhinitis spreading by rhinovirus, it is not going to affect the lungs, it is only an upper respiratory tract infection. So वहाँ पे you will find nasal congestion, that is your nose blocking will be there. वहाँ से डिस्चार्ज आएगा, यानी आपको बार बार स्नीजिंग होगी, वहाँ से डिस्चार्ज आएगा. योर थ्रोट माइट बी सोर, आपको खराश होगी. होर्सनेस इन द वॉइस, देयर माइट बी कफ, देयर विल बी हेडेक, tiredness. You very well know these symptoms, you must have experienced this yourself as well, and within 3 to 7 days this might also reduce in their intensities and finally you get rid of this common cold. So that was about our first viral disease. Let's move on with the second one. Second we have that is called as influenza or called as flu. So this is going to be caused because of a pathogen called as myxovirus influenzae, which is also a viral virus because we are studying about viral diseases. So ये जो virus है, it is going to go into a healthy person because of again elaining droplets or aerosols from the infected person, or it can also be because of contaminated various objects, like if you are sharing glasses, if you are sharing utensils, या पब्लिक प्लेसेस में जहाँ पे बहुत सारे लोगों को फ्लू हुआ है. There also, if you are using common things like lift buttons or door knobs, from there also you can transmit this influenza virus. Then you can have the symptoms of influenza so that you can know about what it is. So you are going to have fever if you come across this pathogen. आपको फीवर स्टार्ट हो जाएगा, आपको बॉडी एक होगा, दैट इज ऑल ओवर पेन इन द बॉडी. It is going to affect your nose, throat and air passages, just like you have your previous disease, that is rhinitis. Rhinitis में upper respiratory tract infections हो रहे थे. Similar symptoms will be seen in influenza as well, but major difference that is going to be seen is fever. So fever and body ache is going to be seen in influenza, but that you don't see in the case of rhinitis. But वहाँ पे भी you will see that there is nasal congestion, वहाँ पे भी आपको hoarseness होगी, वहाँ पे भी आपको cold होगा, sore throat होगा, headache होगा, you will have sneezing, and here we also have extra, that is fever and pain all over the बॉडी. हो सकता है कि आपने निगलेक्ट किया कि जस्ट थोड़ी सी सर्दी जुकाम है, आपको थोड़ा सा बुखार आया है, ये सोच के इफ़ यू नेग्लेक्ट दिस इन्फ्लुएंजा सिम्टम्स, इन द निगलेक्टेड केसेस इट कैन ऑल्सो कॉम्प्लिकेट द केस and bring about other pathogens that attract to this cases, और आपको निमोनिया की भी चांसेस हो सकते हैं. You might also contract other diseases like bronchitis and ear infections because of this symptoms which are neglected. तो हो सकता है कि बिकॉज ऑफ यू आर नेग्लेक्टिंग कि 3-4 दिन हो चुके हैं एंड यू आर नॉट टेकिंग एनी medications for the symptoms, and you neglect and keep it for many days as it is without any improvement, then हो सकता है कि case instead of getting better, it goes on to a next infection that is worsening the case. So if you are not feeling well, not taking medications, then go and consult a doctor so that you can be better in no more time. सो यहाँ पे डिफरेंसेस है अबाउट कोल्ड. सो कोल्ड एंड कफ जो आप बोलते हो, दैट इज गोइंग टू बी योर राइनाइटिस, और जो आप फीवर आया है बोलते हो अलॉन्ग विथ जनरली राइनाइटिस एंड इन्फ्लुएंजा कम्स टुगेदर, कि आपको एक बार सर्दी जुकाम की भी सिम्टम्स दिखते हैं एंड यू ऑल्सो हैव फीवर अलॉन्ग विथ इट. So generally this comes together, and it is very difficult to differentiate of the symptoms because these are almost same. But cold अगर अकेला है then the symptoms are going to be mild enough, and influenza में symptoms are much more severe. There are going to be body aches in influenza, whereas headache is going to be very common for the rhinitis. So that was about the second disease of viruses. The third we are seeing, that is about poliomyelitis, also shortened as polio. And polio was a very common disease in previous days, wherein after a few years of independence भी ये poliomyelitis के cases दिखते थे. But because of a huge scale of vaccination programs, almost we have eradicated the cases of polio from India. But as it also used to prevail, and you should understand about this disease as well, so we are studying it over here. So polio जो होता है, it is going to be transmitted by a pathogen that is called as polio virus, which is very important to remember. It is a single stranded RNA virus, यानी उसका जो genetic material होगा, it is not going to be DNA but a single stranded RNA. And this single stranded RNA containing virus, that is polio virus, it will be spreaded through intestinal discharge. So हो सकता है that once the infected person is eliminating its feces, or these feces have been thrown into water, और ये पानी अगर किसी ने पी लिया, this contaminated water or contaminated food, और इवन द कंटेमिनेटेड फूड एंड वाटर के ऊपर जो फ्लाइज होती है, इवन द फ्लाइज एंड अंदर के जो insects होंगे, these can contaminate and it can spread to the healthy person, and then it will be entering into the alimentary canal because it is spreading through contaminated food and drinks. सो इट विल एंटर योर गट और एलिमेंट्री कैनाल में जैसे ही ये वायरस पहुंच जाएगा इट विल मल्टीप्लाई एंड फ्रॉम द एलिमेंट्री कैनाल इट विल रीच योर नर्वस सिस्टम. सो जनरली नर्वस सिस्टम में स्पाइनल कॉर्ड पे इट विल अटैक and the spinal cord once it is attacked and the incubation period of 7 to 14 days the symptoms will start to be observing after 7 to 14 days of infection. और जैसे ही ये स्पाइनल कॉर्ड पे वायरस पहुंच जाएगा आफ्टर मल्टीप्लिकेशन द सिम्टम्स विल बी मच मोर prominent and now you need to understand about these symptoms. So symptoms में जो होगा it is going to be first of all inability to bend the head forward because once the spinal cord has been affected मूवमेंट में परेशानी आना शुरू हो जाएगा. इट विल बी अ काइंड ऑफ स्टिफनेस इन द नेक एंड वंस द स्टिफनेस हैज बीन ऑब्जर्व्ड यू कैन एस्टिमेट that paralysis has been started in the particular skeletal muscles. And after the attack of paralysis has been begun there is going to be high fever because now the body knows कि यहाँ पे कुछ तो भी invasion हुआ है and now you have to fight against it. So a very first step for fighting against any sort of pathogen is going to be rising the body temperature. So body temperature rise hoga, that is high fever, there will be headache, there will be chills, there will be pain all over the body, and slowly and steadily as the case worsen there is going to be muscles of larynx as well as pharynx which are going to get involved into paralysis. And because of these muscles जो respiratory tract के आसपास होते हैं and because of these muscles also getting involved it may happen that at the some point breathing stop हो जाए. So this can also lead to death of the person because of the muscles involved that is coming from the respiratory tract. So what can you do for the patients who have suffered from or are suffering from polio, and what can be the preventive measures so that you do not contact with this polio disease. So first of all the patient should be kept in isolation. जिसको भी ये हुआ है पोलियो उसको isolation में रखो so that you do not contaminate with any sort of things. Then the person should be given complete rest because बहुत ज़्यादा pain हो रहा होगा and the person would not be in a condition to stand or move its legs or hands. So complete rest should be provided. There should be proper disposal of urine and feces because this is the case which is going to cause the further contamination of things. So यूरिन और फीसिस को अच्छे से डिस्पोज करना चाहिए so that it does not come in contact with any of the healthy person and then spreads this polio virus. So once this is been taken care of हो सकता है कि केस वो बाकी लोगों तक ना फैले. But now if you take extra precautions कि आपको होने से पहले ही if you take precautions then what can you do? First of all it can be prevented because polio doesn't have any sure cure. उसको कोई इलाज नहीं है and because only one thing that you can do is you can prevent it from happening. So that can be done with a vaccine. Vaccines are safe and very effective. Vaccines जो होते हैं these are given to kids up till 5 years. So polio drops या polio टीका के बारे में you must have already heard about and even you must have taken these drops. 2 बूंद polio के vaccines you are given orally up till the age of 5 years and then this vaccine is very much effective against polio virus and उसकी वजह से many of the kids have not suffered from polio after this mass vaccination program और अभी पोलियो के cases ना के बराबर आते हैं because of that the country has been declared that we are free from polio disease. So this is generally going to affect the kids from about infant ages. So it is also called as a infantile paralysis because इनमें जो muscles होते हैं वो काम करना रुक जाता है and it occurs in small kids. So from the ages from about 6 months or so the vaccinations will start and now this infant is free from polio virus then it will be okay for rest of his life. So वो ऐसे पोलियो के बच्चे होते हैं जिनको दे कैन नॉट मूव प्रॉपरली उनके लेग्स मसल्स वर्क नहीं करेंगे and they won't be able to stand again back on their feet because of these kinds of paralysis. So it is very important कि ये vaccines every kid should get and so that it can be prevented for their rest of the happy life. The next disease we see is a dengue fever. Dengue fever के बारे में भी you must have heard about for sure, but now let's see it in a different angle about who is causing dengue fever. So the pathogen of it is going to be arbovirus. बोलते हैं dengue fever मच्छर की वजह से होता है. But exactly now you know that the mosquito is just a vector. Okay, what is it? Mosquito is just a vector. Vector यानी क्या है? It is just a vehicle. जो पॉजिटिव एजेंट है वो पॉजिटिव एजेंट को एक इंसान से दूसरे इंसान तक ले जाने वाला व्हीकल है, जस्ट लाइक ऑटो रिक्शा. ऑटो रिक्शा में कौन बैठा है? अर्बो वायरस बैठा है, हु इज गोइंग टू इन्फेक्ट द ह्यूमन. whereas mosquito is just a vehicle, it does not play any role other than transportation of this virus. So this virus is going to be seen in the mosquito, and this mosquito, once it goes from one infected person to the other healthy person and bites it, तो वहाँ पे हेल्दी पर्सन में जब इन्फेक्टेड पर्सन का ब्लड मिक्स हो जाता है, then this virus is being transmitted, and the bite of a specific mosquito is going to pass on this virus, and that mosquito is going to be female Aedes aegypti virus mosquito. So this mosquito is also called as a tiger mosquito because the legs of this mosquito is going to have black and white stripes. So black and white stripes होने की वजह से उसे tiger mosquito भी बोलते हैं, and these stripes are very much famous that this is causing dengue fever. So here also you can see in the photograph about how the legs have different colorations, and even on its body you can see black and white stripes, that is your Aedes aegypti mosquito. So incubation period जो होगा, that means it can be stable for how much long? It can be for 3 to 8 days, and then you can find some symptoms about dengue fever. So what can be the treatment given for this dengue fever? First of all, if there is fever, and paracetamol tablets should be taken on the advice of a doctor. And a very important point that you need to remember, that aspirin and dispirin are the two tablets that you should not consume. It should be avoided during dengue fever. There should be cold sponging because temperature बढ़ेगा, और जब भी fever high होगा, cold sponging will try to reduce the body temperature and the patient will feel much more better. Even with it, there should be plenty of liquids provided to the patient so that dehydration वगैरह ना हो already, because the body is fighting with this virus. So plenty of fluids will keep the body otherwise healthy, and it can fight against, and the patient can get better in a much more lesser time. Then there is no vaccines for this disease, so you can only prevent the bite of mosquitoes. So मच्छरदानी लगा सकते हो, you can use mosquito repellents, you can reduce the population of mosquitoes कि आप गंदा पानी स्टोर करके ना रखो, या you change the water from the coolers और मटकास जो होते हैं, you change the water, don't keep a stagnant water, या stagnant water ponds में वगैरह है, there you can use gambusia larvas. So gambusia is a fish जिसके larvas या वो fish को if you leave that in the pond or stagnant water pond, this fish is going to eat the mosquito larvas. So mosquito larvas अगर खा लिए ये fish ने, so in a way you are controlling the mosquito population, and that will be a preventive measure for the dengue fever, because vaccines available नहीं है. If the person is suffering from dengue, then he has to go through the medication process and get out of the dengue fever. So that is only the one way that you can do once you are infected. If you want to prevent it, then prevent the mosquito bites by the various methods that I told you. So the next we need to see that in dengue fever there are going to be two cases. The first, that is a classical dengue fever. Second जो होता है, that is dengue hemorrhagic fever. So classical dengue fever में there are symptoms like the onset of high fever. There will be frontal headache, यानी आँखों के ऊपर का जो area होगा, that is your what do you say, your forehead. Your forehead would be in severe pain. There will be pain behind your eyes, which is again a very important point that you need to remember, because जो आपको नॉर्मल इन्फ्लुएंजा वाला फ्लू वाला जो हेडेक होता है या राइनाइटिस वाला हेडेक होता है उसमें देर वोंट बी पेन बिहाइंड योर आईज. योर पेन बिहाइंड योर आईज could be a very big symptom for dengue fever as well. So it will also worsen with eye movement, and that can also be one of the symptoms to understand about dengue fever. Muscle joints hoga, muscle and joints में pain होगा. There will be loss of sense of taste. You won't feel like eating anything. There might be rashes all over your chest and upper limbs, along with vomiting and nausea. So these are the symptoms for classical dengue fever. The dengue hemorrhagic fever will have the symptoms of this as well. Along with this, the symptoms are going to be what? These are going to be bleeding from the nose. Since the word is hemorrhagic यानी यहाँ पे कुछ ना कुछ bleeding के related होगा. So it is going to be somewhere related to bleeding, or you can say it is related to blood. So there will be bleeding from the nose, mouth and gums, and the skin will be bruised. वहाँ पे severe continuous stomach pains रहेगा, because it might be a case of internal bleeding as well. वहाँ पे frequent vomiting होगा, that might be with or without blood depending upon how severe the pain of stomach is. The patient will be very cold, उसके हाथ पैर ठंडे पड़ जाएंगे, and the patient will be having excessive thirst because it will also have a dry mouth. There will be rapid weak pulse, difficulty in breathing, restlessness and constant crying, because वो दर्द के मारे continuously crying actions will be done by the patient. So these are the some symptoms for the two types of dengue fever. The next we see about is chikungunya. Chikungunya जो है, it is going to be a viral disease caused by chikungunya virus, and chikungunya के बारे में एक history भी है, that from where did it come. So it was first isolated from human patient, and the vector was the same mosquito from the dengue fever, that is Aedes aegypti mosquito, and it was first found out in Tanzania in 1952. So again, that tiger mosquito black and white stripe is going to cause the chikungunya disease. So symptoms for chikungunya, first of all, is going to be onset of fever. So fever ana is very common in many of the diseases. There might be crippling joint pain. Then a very important point जो आपको differentiate करते आना चाहिए, that is lymphadenopathy and conjunctivitis. So these two are not going to be found in any other disease that we have studied up till now. So conjunctivitis, you know that the cornea is going to become inflamed, वो red हो जाएगा. So you can see the conjunctivitis case over here in this diagram, जहाँ पे आँख लाल हो चुकी है. So आँख आना जिसको बोलते हैं, that is nothing but conjunctivitis. And then you see a very other thing, that is lymphadenopathy, which means that the lymph glands will be swollen. So swollen lymph glands, the lymph glands, you know where they will be present. Generally they will be present in your armpits, in your groin region, under your neck जहाँ पे tonsils होते हैं. All those will be swollen because of the infection. And even there will be patient who will be walking as doubled up, and doubled up walking is nothing but जैसे हाथों पैरों में ज़्यादा ताकत नहीं होगी. So even the patient might be using his hands to walk upon. So doubled up is that meaning that the patient will start using his hands for walking or for movement because of severe joint pain. So चिकनगुनिया में बहुत ज़्यादा joints में दर्द होगा, which is going to be differentiated from dengue fever because of conjunctivitis and swollen lymph glands, and even a very different kind of joint pain. So that was about chikungunya, wherein हड्डियों में दर्द होने लगता है and all the joints will start to pain in chikungunya. The next we see is about hepatitis, which is going to refer to inflammation of liver, because hepatitis may hepatic vein, hepatic portal system, all that words are nothing but related to liver. So inflammation of liver जब भी होगा, it is going to be a case of hepatitis. It can be caused either because of a virus or some drugs, and even because of chemicals including alcohol. So there are various kinds of hepatitis. So the first one we see is hepatitis A, and the next comparison we have hepatitis B. Next slide we will see about hepatitis C, D and E. So hepatitis A may, it is called as an infectious hepatitis. It will be caused by the virus, that is as per the name, that is hepatitis A virus. यहाँ पे you need to remember it is a single stranded RNA virus which is going to have non-encapsulated capsid. So this is a very important point regarding the causative agent. Then the next is how is it spread. Mode of transmission is going to be fecal-oral route. So fecal-oral route है यानी अगर feces of the contaminated patient is being mixed with the water or the feed, then if the healthy person is eating or drinking this fluids or the solid substances, तो ये जाके hepatitis फैलाएगा. So that is the oral fecal route. Then there will be mild disease seen in the case of children. Young adults are much more attacked by this hepatitis A, and the symptoms will be considering, that is anorexia, that is loss of appetite, malaise, nausea, diarrhea, fever and chills, which will be recovering in about 4 to 6 weeks. So that was about hepatitis A, जहाँ पे we saw about the pathogen, the mode of transmission, and to what age group do they generally signify, and the symptoms of this disease. Then hepatitis B is going to be a serum hepatitis. That means it will be spreaded because of contaminated blood. So इसका जो causative agent है, it is going to be hepatitis B virus. और इसके virus के बारे में क्या speciality है, that it is going to be consisting of 42 nanometer enveloped virus. Previous one was non-enveloped capsid. This one is going to be a enveloped virus having partially double stranded circular DNA. So पहले वाले में single stranded RNA था, now you have a double stranded singular DNA as a genetic material, and this will be spreaded because of sexual contact or contaminated syringes, transfusion equipment. In a way you can say that it can be contaminated because of blood, tears and saliva. So that is the mode of transmission of this virus, and vaccines are going to be made for this hepatitis B, and it can be possible because of recombinant DNA technology which was available to prevent hepatitis B. And very important point that you need to remember, that is going to be, it is going to be a second generation vaccine. So यहाँ से बहुत important question पूछा गया था, that what generation vaccine is hepatitis B. Then it is going to be a second generation vaccine which is going to be prepared by the recombinant DNA technology. The hepatitis C is another type of it which is going to be called as non-A non-B hepatitis. It is caused by a virus that is called as hepatitis C virus, which is again going to be an enveloped virus with a single stranded RNA. It is going to be clinically similar to hepatitis B, यानी mode of transmission जो होगा, it is generally because of blood transfusions and saliva and tears. Whereas hepatitis A जो था वो कैसे spread हो रहा था, it was because of the oral fecal matter, but hepatitis B and C will be because of the blood transfusions majorly, and it will be having symptoms that is causing of cirrhosis and even possibility of liver cancer. Then comes the hepatitis D, which is called as delta hepatitis, caused by hepatitis D virus. Again it is a single stranded RNA virus, and it will be spreading similar to hepatitis B. So that is nothing but your blood transfusions, like you can similar to B, or you can also say similar to C. So the person who has been contracted with hepatitis B now is going to be contracting hepatitis D. So जिसको B हुआ है उसी को D होगा, जिसको B नहीं हुआ है उसको D नहीं होगा. So before contracting hepatitis D, you should have hepatitis B, then you can come to D. So it is very important point that you need to remember, and the severity of the disease will change. In hepatitis B, symptoms were different. Hepatitis D में symptoms will become much more severe, and there will be liver damage, there will be fatality rate will be higher than the hepatitis B alone. So जिसको hepatitis B अकेले में है, like only hepatitis B, these persons might have mortality rate which is lower, but the persons advancing to hepatitis D, उनका survivability rate will be decreased a bit. And last one we see is about hepatitis E, which is going to be infectious and NANB hepatitis caused by hepatitis E virus. Again, it is a single stranded RNA virus. So इतने सब होने के बाद what did you understand? That only a double stranded circular DNA was found in what? It was only found in the hepatitis B virus, and hepatitis B virus में ही you are going to find your double stranded circular DNA. Others all will be having single stranded RNA as their genetic material. So that is one important point that you need to understand by the comparison of these all types. फिर आपको ये भी पता होना चाहिए that how is it going to spread. So spreading जो होगा it will be similar to hepatitis A, that is your fecal oral matter, यानी contaminated food and water से hepatitis A and E is going to spread, and it will not be a chronic liver disease, but it will be having a higher mortality rate in the pregnant woman. So that was about hepatitis A, B, C, D and E. Moving on with the next disease, that is smallpox. Smallpox caused by variola virus, which is a double stranded DNA virus, to be remembered again. उसके पहले जो हमने देखा था डबल स्टैंडर्ड में, one that was the hepatitis B virus. Second we see over here in this video, that is the smallpox virus, or also called as a particular name, that is variola virus. Mode of transmission होगा that is through the oral and the nasal discharges of the patient, and it can be getting out of the infected person through, it can be coughing, it can be sneezing, or it can be formits, यानी bare hands से sneezing रोका हुआ होगा, and if the patient touch the surrounding places, then it can infect the healthy people. Symptoms of smallpox can be high fever, chill, then backache, headache, and also appearance of rash, which is a very important point about smallpox, and that will be on the third day of the infection. And the rashes will first appear on the face, they will rest, then appear on the body. But सबसे पहले कौन infect होगा? The face will be infected. First appearance to be remembered, because now this will be a differentiating point between smallpox and the next disease we see, that is about chickenpox. So smallpox में there will be appearance first on the face, then rest of the body. And one more important point you need to remember, that is it will be more on face and limbs, and then less on the trunk. So face and limbs, हाथों पैरों पे और मुंह पे ज़्यादा होगा, less on the stomach or back area. And it will be opposite in the case of chickenpox. Chickenpox में क्या होगा? It will be less on face and limbs, but more on your chest region and your back region. So because of that, you need to remember the difference between smallpox and chickenpox. So smallpox के जो rashes होते हैं, how these are going to advance? First of all, these are going to be starting with a rash with small reddish spots. Reddish spots जैसे ही आना शुरू होंगे, they will be having papules, which will be then transforming into small vesicles, यानी इनके अंदर fluid, clear fluid fill up होना शुरू हो जाएगा. Then there will be pustules, then there will be a stab formation, यानी बहुत ज़्यादा बड़ी खपली जैसे आना शुरू हो जाएगा. and that will fall off after 3 weeks. And now once these stamps have been fallen off, now what will happen, there will be deep pits or scars, or you can also call it as poke marks, which will be left out onto the skin of this infection. So smallpox, if you want to see that how the smallpox scars are going to be visible, so there is one person who is Om Puri. So you must have heard about him in Bollywood cinemas. So Om Puri is a person who has smallpox marks, and those marks on his face are because he had suffered from smallpox during his childhood. So वो marks है because of these smallpox that he had suffered from. One more important point about smallpox that you need to understand, that now smallpox is almost eradicated from India because vaccines are available, and vaccine for smallpox was discovered by Edward Jenner. So it was a very kind work done by Edward Jenner because he was able to find the vaccine. So he is the person who had found out the vaccine in 1798, and this was the best preventive remedies that are available for smallpox. So vaccines की वजह से that was discovered by Edward Jenner, the smallpox is almost eradicated from India. The next one is the chicken pox. So chicken pox जो होता है, it will be called as very commonly people get chicken pox during your younger ages, and it will be caused by varicella zoster virus, which is again a double-stranded DNA virus. This is the third time we are seeing about double-stranded DNA virus. Previous two we have already studied and you know the names till now. So this virus is going to be transmitted, and it will be passed on to a healthy person from the discharges of the respiratory tract. And once these droplets are going to go and sit on to some other articles like doorknobs, या बच्चों को जनरली ये होता है. सो जिन बच्चों को चिकन पॉक्स हुआ है, these are not allowed in schools because हो सकता है if the person starts sneezing, and ये sneezing के droplets surrounding benches पे या किसी के bags पे, books पे, bottles पे, अगर कहीं पे भी these are going to fall, then the transmission of this virus is going to occur, and that can spread from one child to another. So generally the children who have started the symptoms of chickenpox are trying to avoid meeting with other people so that the transmission can be stopped over there. So what are the symptoms that can help you to understand it is chickenpox? First of all, the symptoms are very mild but they are highly infectious, so it is better if you keep the patient isolated so that you don't come across this infection. So first of all, it will start with a slight fever. There will be rash all over the places, or rash जो होगी it will be almost similar to smallpox, that is vesicles will be formed, there will be fistules formation, finally there will be a dark brown staph and it will be falling off. But very important, there will be no scar left out. So वहाँ पे scars नहीं होंगे, it will just fall off, and the rashes will first appear onto the trunk region. So first appearance trunk पे है, and it will be very less on the case of faces or limbs. So हाथों पैरों पे कम होंगे, and because of that it becomes very difficult for the people to understand that if the person is having chickenpox, and in the starting days of the rash हो सकता है उस टाइम पे ये चेस्ट रीजन पे या स्टमक पे या बैक पे आए, and during school days you have uniforms, so generally those areas are covered very perfectly. So because of that this will not be seen in the initial days, so it might infect a lot of people, and then those people should be staying at home not to meet anyone else so that the transmission of that can be stopped. So that was about chickenpox. बहुत सारे लोगों को चिकन पॉक्स हुआ होगा, you might have experienced those symptoms as well, and that will be a life example for you to remember the symptoms of the chicken pox. So next disease we see is measles, also called as rubella disease. This will be caused because of a rubella virus, which is again a double-stranded DNA virus. The mode of transmission is going to be from the throat and nose of the infected person, again that is droplet infection, and the articles around the infected region will also be the potent source for mode of transmission. Symptoms जो होंगे, that will start with a high fever, it will start with the nose and throat infections, and there will be inflammations of those infected areas. Generally infected areas में inflammation of air passages होगा. There will be rash all over the body, and this rash is slightly different because it is going to be pinkish in color, and it will start to appear first on back. So वहाँ पे क्या आपको याद रखना है, that where is going to be the फर्स्ट साइट जहाँ पे रैशेस आना शुरू हुआ है. सो इफ द रैश फर्स्ट स्टार्ट्स टू अपीयर ऑन टू द फेस एंड लिम्स, देन इट इज़ गोइंग टू बी स्मॉल पॉक्स. अगर वो सबसे पहले ट्रंक पे आ रहा है, then it is going to be a case of chicken pox. अगर वो आ रहा है back of ear या back of face, then it can be a case of measles. So it is very important to understand कि first sites of infection कहाँ है. Then the eyes might become red and watery, and the flesh will be flushed, yani it will be swollen because of the rashes that might be going all over the face. So that is, again you can see in the photographs how the symptoms are visible in the case of measles disease. The next we see is mumps, which is also called as infectious parasitis because it will be infecting the salivary gland, that is called as parotid gland. So it will be caused by a pathogen called as paramyxovirus, and this paramyxovirus is going to be spreaded from one person to another once it comes out of the saliva of the infected person, and that can spread from one person to another. So symptoms जो होंगे, these are going to be infectious diseases. Infection हो रहा है, that means fever is very well understood as a symptom. There will be difficulty in opening the mouth because near the end of your mouth you will have the infection in the parotid gland, which is a salivary gland. So salivary glands में infection है, so saliva is going to be the potent mode of transmission. So this parotid gland में swelling हो जाएगी, it will be a very painful situation, and even between the lower ears will also pain because these parotid glands are going to be situated at that region. So the treatment is is not a very complicated scene. The treatment can be given onto this infection, and in some cases there might be pain and swelling of testicles as well, and it might also lead to pain in abdomen because of further infection sites. But if it is just localized into your swollen parotid glands, in few days because of medications these symptoms can be reduced. And another thing for this, that is mumps and measles, you can also have a vaccine available which is called as MMR vaccine. So MMR vaccine may you are going to have three diseases that are covered. The first M stands for measles. So measles we have discussed about it. Then we saw about mumps. So mumps can be prevented from this vaccination, and the third R is going to be for the rubella. So three diseases, that is measles, mumps and rubella, can be combinedly given a shot through vaccination, that is MMR vaccine. The next we see about rabies, which is also called as hydrophobia. The pathogen is going to be rhabdovirus, and the mode of transmission is through the bite of rabid dog. So very important to understand, it is a bite of a rabid dog. So the dog who is already rabid is going to be causing the rabies. जिसको rabies नहीं है, वो dog को rabies नहीं है, then it is not going to spread rabies to humans. So that is very important. So dogs may, it can also be infected because of jackals and wolves. So generally you don't go and vaccinate these wild animals like jackals and wolves, but pet animals like dogs and cats can be vaccinated because of this rabies. So जो animals have been vaccinated thoroughly, very correctly, then the chances of spreading of rabies can be decreased. So people who have pets, अगर आपको bite हुआ है because of your pet dogs or cats, then you should go and consult your doctor whether you are at a potent source of contaminating through rabies virus or not. So incubation period can be from about 10 days to 1 year. So आपको अगर bite डॉग ने आज किया है तो हो सकता है द सिम्टम्स विल नॉट बी विजिबल टू यू, इट कैन बी विजिबल आफ्टर अ ईयर, और वंस यू गो आफ्टर अ ईयर हो सकता है आपको याद ना रहे दैट द डॉग हैड बिट यू. सो at that time you might not refer to it, but once you have a dog bite or any cat bite or other mode of transmission that can occur, you should go and consult your doctor so that he or she will guide you further about the treatment. So symptoms आपको क्या होंगे once it is confirmed that you are positive for rabies? The symptoms will be seen, that is you will have fear for water, because it is said that the dog who is rabid, who is mad, who has the virus of the rabies, that is rabidovirus, he will be leaking out a lot of saliva, he will be moving out in terror, he will be going mad because this virus has been taken over the control of his body. So वो इतना ज़्यादा saliva, it will be drooling out of his mouth, and once he bites you, अगर आपने उसकी शक्ल देखी है, so you might be scared of that drooling and you might feel that again that dog is going to bite you. So ऐसे बोलने की वजह से the people say that the person who has rabies is now becoming scared of water. So other symptoms that can be, that is excess of salivation, as in dogs you can see the dogs who has rabies, they will also have excess of salivation, there will be severe headache, there will be high fever, alternating periods of excitement and depression, and inability to swallow food and even water, और वैसे choking जैसी feeling आएगी that you cannot pass anything through your throat down. So that choking feeling can also come in this rabies as the symptoms. And finally the virus is going to go and attack into your brain and spinal cord, so your entire central nervous system is going to take in control over by rabies. So जैसे ये symptoms आपको humans में होते हैं, similar symptoms will be seen in the case of rabid dogs or the animals that we saw above. So those animals also have these kinds of symptoms, because of that these don't know that these are going to come and bite you, वो आपको intentionally bite नहीं करेंगे, because of that inability to control their brains, because now you know that the symptoms have that the virus destroy their brain. So अगर वो human brain को destroy कर सकता है, the same virus is going to infect the dogs as well. So that means the virus is destroying the brain and the spinal cord. Because of that the dog is, or the cat or the infected animal is not intentionally biting you, वो गलती से bite हो जाता है. So precautionary reasons should be taken once the bite has been noticed. So for that reason also, ones who have pet animals, so like dogs or cats or any other animals, the vaccination program should be conducted by a good veterinary doctor, so that even if you have a bite, that might be prevented from rabies. And a very important point also we like to discuss over here, that is World Rabies Day has been celebrated at September 28th. So September 28th has been decided for World Rabies Day, wherein the knowledge about rabies can be spread to lot many people. And on this day you can get many seminars going on for the information about rabies. So that was about our next viral disease. Moving on to the very important point, that is about solving questions. हमने सारे diseases के बारे में पढ़ लिया है. Now you have all the knowledge about the viral diseases that you need for class 12 as of now. And these are some questions that might help you to actively recall about what you had seen in this video. So you can go through these questions and try to solve and remember what you had understood in the past few minutes. And if you are able to solve this, very good, give a thumbs up and move on with the next topics and solve some more questions. अगर आपको कहीं दिक्कत आती है, if you go and stuck somewhere, go and read your books, you can go and see this video back again and try to solve these questions again. So you can surely post your answers in the comment sections down below, and that would give us a very good interactive time in the comments down below. You can also share your some questions, your questions extra solve करोगे उसमें से if you feel that this question might help others as well, you can share that in the comment section as well. So that would build a healthy communication pattern in this channel. So that was all for this video today. We will come back soon with the continuation of this chapter. If you like this video, अगर आपको इससे help मिली है, then don't hesitate to hit the like button, share it to as many as you know, and subscribe to our channel. Till we come back soon with the next part of this video. Keep studying, keep smiling. Bye bye everyone. Thank you.